Hello everyone. Yes, welcome everyone to the Master Nursing classes. Yes, good morning, very good morning to everyone. Welcoming you all to the Master Nursing classes. Yes, as all of you know that we are discussing the very important questions and concept for our upcoming RRB, Nursing Superintendent and Norcet 8 exams. So here not only we are discussing the questions, from each questions I am discussing the all possible other questions also. So that may directly strikes in your upcoming nursing competitive exams. Yes, good morning, very good morning. Welcome everyone to Master Nursing classes. If anyone is new to the session, so please do subscribe to the channel. Okay, who all are live to this session, so please press the like button so I can continue with the class. Yes, very good morning. So yes, this sincerity, this dedication, this consistency I want. So I am conducting the class in morning 6:30 only. So this many of you joined the live session. Okay, that is shows how much you are dedicated towards your uh, goal. Okay, yes, very good morning, dear. Welcome. Chalo. So without wasting the time, we'll start the today's class. Many of you have already joined. Okay. So is that my voice is clear to everyone? So please do thumbs up in the comment box. Yes. Very nice of you here. Okay. So we'll start with the class. Here is the first question. So do read the question carefully, completely. So while explaining the answers, so I will be less conscious about the comment box. Okay. So why? Because I don't want to break the flow in the explanation. So once after explanation of the complete questions, I will come to your comment box. Okay. So till that, so do commenting in the comment box. Okay. So then after we will discuss the any doubts in the session. Okay. So yes, here the first question: which type of the cell in the placenta is primarily responsible for the phagocytosis? Okay. So which cell from the placenta? Okay, that is primarily responsible for the phagocytosis. Okay, so definitely one questions will comes from this question. Okay, so the concept I will teach you here. So many times they have asked in the Norcet also. Okay, there is highest chance of asking in the RB as well. Yes, so the first option is microglial cells. Option B is the Kupffer cells. Option C is the Haub-Boer cells. Option D is the Nita-Book cells. Okay, so which cell is the cell which is responsible for the phagocytosis in the placenta? Okay, what is phagocytosis? Phagocytosis is the process of identifying and engulfing and destroying the microorganism. That is what we call as the phagocytosis. If any microorganism which comes to our body, okay, our immune cells activates. Okay, it will identifies. Okay, it will make a elongation of the cells. Okay, so then it will engulf. Okay, it will take the microorganism inside of the cells. Okay, with the help of the lysosome enzyme. So it will destroy this microorganism and it will excrete it out. So this process of identifying, attaching, engulfing and destroying the microorganism, this process we call as the phagocytosis. There are special type of the phagocytic cells are there in our body which protects us from the infectious agents. So which type of the phagocyte cell is there in the placenta? Okay, yes, very nice of you all. Okay, few of you given already answer for as a Haub-Boer cells. Okay, Haub-Boer cells are the correct answer. Option C is the correct answer for this question. Okay, so where the microglial cells act as a phagocytic cells. So microglial cell act as a phagocytic cell in the brain. Okay, in the brain, which is the phagocytic cells we are having. Okay, that is the microglial cells. Then where is the Kupffer cell acts? Can anyone able to comments? Yes, where the Kupffer cell acts as a phagocytic cell in the our body. In which organ it is there? Yes, very nice of you all. That is the liver. Okay, so in the liver we are having the phagocytic cells. That is the Kupffer cell. Very necessarily you have to know. And in the placenta, Haub-Boer cell is the our phagocytic cell. Okay, what is the Nita-Book cells? Nita-Book cell is the cells. Students, it is very necessarily how to know related to the Nita-Book cells. Okay, the questions will come. Okay, so as all of you know that in the process of the implantation, what is the implantation? Implantation is the so our zygote in the form of the blastocyst, it will okay, the zygote it will comes in the form of the blasto uh, cyst. Okay, so and this blastocyst will attach to the our endometrium. Okay, so implantation occurs in the form of the endometrium. So the implantation should occur to the the which layer of the our uterus? So we are having the 3 layers in the uterus. Okay, so I think all of you know that. Okay, so first layer is the that is the our first inner layer is the that is our endometrium. Then comes it myometrium. Okay, so this is the myometrium, and then comes it the perimetrium. Okay, outer layer is the perimetrium. So this is the inner layer endometrium. So in the endometrium also again we are having the three layers. Okay, that is the Decidua compactum, Decidua spongiosum, and Decidua basalis. Okay, so from this layer, so the blastocyst should and must attach to the first layer, that is the or Decidua compactum. Okay, for this layer it should attach. Okay, if the blastocyst it will go till myometrium, means we call that is the morbidly adhered placenta. Okay, so again in that one we will study the placenta accreta, placenta percreta, and placenta yes increta. So that kind of the morbidly adhered placenta will study. Okay, don't worry, we'll study in the next questions itself, so don't worry about that one. Okay, so as I told, the blastocyst must and should only attach for the our endometrium. So which cell which protects the blastocysts, or which separates the blastocyst and myometrium, means here is the one layer of the cells, that cells is called as the Nita-Box layers. So this Nita-Box layers of the cells which prevents the attachment of this blastocyst to the myometrium. Okay, so this is the very basic concept you have to know. So means the Nita-Box layers of the cells which is very much necessarily responsible for preventing the blastocyst attachment to the myometrium. Okay, is that clear, students? Yes, which layer which protects the attachment of the blastocyst to the myometrium? Yes, the Nita-Box layer of the cell which prevents the attachment of the blastocyst to the myometrium. It's very basically how to know. Okay, hope the a few questions are clear here. And here is the next question in front of you all. Yes, very basic question. Hope the concept is clear for the last question. Yes, very nice of you all. Okay, so here is the very basic question. Yes, which of the following condition is not treated with the methotrexate? Wow. So this drug, this is very important drug, that is the methotrexate. Okay, so the nursing responsibility in the methotrexate they have asked in the exam. Okay, many times. So it is very important. Okay, consider as a very important question. Yes. So which of the following condition is not treated with the help of the methotrexate? So methotrexate is a anti-cancer drug. Okay, and this is also used as an antifolate, means it will act against the folic acid. Okay, so this is the antifolate drug. So this can be used for the treatment of the can anyone able to tell the answer in the comment box, which is in which condition we can't use the methotrexate? Yes, very nice of you all. For the treatment of the hypertension we can't use the methotrexate. Okay, yes, the option C is the correct answer. Okay, so it means the methotrexate can be used for the treatment of the psoriasis. Psoriasis is the skin condition. Okay, it is autoimmune disease of the skin where the plagues, silver like plagues will comes on our skin. And the peeling of this plagues will be there continuously. That is called as the psoriasis. Okay, so we can use the methotrexate for the treatment of the psoriasis. Okay, and for the rheumatoid arthritis, drug of choice for the rheumatoid arthritis is the methotrexate. Okay, severe rheumatoid arthritis में drug of choice कौन है? Okay, which is the drug of choice for the severe rheumatoid arthritis? That is the drug of choice. Okay, that is the methotrexate. Yes, is that clear? Clear. Okay, certain type of the cancer. So as I told, it is used in the treatment of the cancer. Okay, so hypertension we can't use with the help of the methotrexate. Okay, so take some bullet points on the methotrexate and note it down in your last minute revision notebook. Okay, methotrexate, as I told, it is an antifoliate drug also. If we give methotrexate in the pregnancy, it will lead to the neural tube defect. Okay, why? Because I told already which vitamin is very much responsible for prevention of the neural tube defect, that is the folic acid. Okay, so here the methotrexate acting as a against the folic acid. So if we give methotrexate in the pregnancy, it reduces the folic acid. Okay, so the folic acid decrease means it will causes the neural tube defect. Okay, is that clear? Clear. Okay, so methotrexate is the drug which is used for the severe rheumatoid arthritis. Okay, once a week. Okay, so yes, it is used one tablet per 1 week. Okay, very basically. Okay, and it is very much necessary. You have to give the folic acid supplementation. Okay, folic acid supplementation you have to give to the patient who is taking the methotrexate. But the point is we can't give the folic acid and methotrexate on the same day. Okay, so that's what I told. This drug methotrexate should be given once in a week. Okay, so 4 days of the folic acid we can give. Okay, that is so on Sunday we are giving them methotrexate means. Okay, next day we can't give the folic acid. Okay, from second day third day, fourth day, fifth day, we can give the folic acid. Then after one day gap, then after we have to give the methotrexate. Okay, so one day before methotrexate, one day after methotrexate, we can't give the folic acid. Okay, after that we can give the folic acid, because the methotrexate we are using in the treatment of the, yes, rheumatoid arthritis, and it is decreasing the folic acid. Okay, so in order to replace folic acid, we have to give the folic acid, but not on the same day. We can't give methotrexate and folic acid same day. Okay, so I hope the concept is clear. These are the very, very and very important points you have to remember before going your Norcet 8 exams and RRB nursing superintendent exam. Okay, yes, this is the basic you have to know. Yes, and next question is, yes, so at what approximately, okay, what day post fertilization does the morula stage occurs? Okay, so at what approximately what day post fertilization does morula stage occurs? So this is the very basic. Yes, as well, if you know that the fertilization occurs in the fallopian tube. Okay, so do comment the answer in the comment box. So I want to know how many people you are know about the morula stage. Yes, very nice of you all. Okay, yes, that is the option C. Sorry, option B. That is the day 3 is the correct answer. Okay, so approximately what post percolation days does the morula stage occurs means it occurs on the day 3. Okay, so this is our beautiful fallopian tube. In the fallopian tube, this is the ampulla part of the fallopian tube. Okay, so yes, this is the what we can say, fimbria. Okay, so here's our uterus. Okay, so here, from here the ova will come. Okay, from here the sperm will come. The fertilization occurs here. Okay, in the ampulla of the fallopian tube, the perfect and most common site of the fertilization. Okay, so here it occurs. Okay, so after 30 hours, so the single stage zygote means after fertilization this will convert as a zygote. Okay, so sperm plus ova which fuses together with the help of the fertilization, which forms the zygote. Okay, okay, which forms the zygote. I think all of you know that very basic. Already we have discussed in the last session also. This zygote remains in the fallopian tube, and after 30 hours, it will divide into the two cell stage. Means previously zygote on the one cell stage, okay, one nucleus, and after that the zygote becomes the two cell stage. Okay, so it will divide two. Okay, so after 30 hours means it is around 1.5 day. Okay, so that is the 30 hours we can say. Okay, so then after that, so it will remains in the fallopian tube for the 3 days. Okay, it will remains on the fallopian tube for the 3 days, and it will becomes the, yes, morula. What is the morula? Morula is a 16 cell stage of the, yes, 16 cell or 16 to 64 cell stage of the, yes, our zygote. That is what we call as the morula. Okay, students, once after this morula develops, okay, so which looks like a mulberry fruits. Okay, this the zygote, that is a 16 cell stage zygote. Okay, so which looks like a mulberry fruits, so that is what we call this one as the morula. Okay, so first zygote. Okay, second cell stage of the zygote is the blastomere. So this is the blastomere. Okay, so after 3 days it will convert into the morula. Okay, so that is the 16 to 64 cell stage of the our zygote. That is what we call as the morula. Okay, so this morula, okay, on fourth day, so till third day it will be there in the fallopian tube. Okay, on fourth day this morula from the fallopian tube it will comes into the uterus. The questions will arise: in which form zygote enters into the uterine cavity? In the morula form, yes, in the morula form zygote enters into the uterine cavity. Okay, so after this morula, what happens? So this is the 16 cell stage of the our zygote, that is the morula. So this morula becomes filled with the fluid, and it will convert into the blastocyst. Okay, it will convert into the blastocyst. Okay, so the blastocyst on the day 5, okay, fifth day, the blastocyst will be comes in will be present in the our uterine cavity. Okay, on the sixth day, the implantation will occurs. So the questions will comes: on which day the implantation will start? Implantation means, yes, attachment between the this blastocyst to the endometrium. Okay, to the endometrium, that is what we call as in the implantation. Okay, hope the concept is clear. On which day implantation occurs? Implantation occurs on the sixth day. Okay, implantation occurs on the sixth day. Okay, if the question coming on which day implantation completes, implantation completes on the sixth day, sorry, 10th day after fertilization. Okay, whatever the word I am using, it is after fertilization. Okay, after fertilization. Okay, so yes, what we have discussed, that is the after fusion of the sperm and ova, it forms the zygote. Zygote is a single cell stage. So after 30 hours, the zygote becomes the double cell stage. That is what we call as the blastomere. Okay. So after 3 days, the double cell stage of the our zygote will get converted into the 16 cell stage. That is the that is the what we call morula. Okay, which looks like a mulberry fruit. So we call that one as the morula. Okay, that morula on fourth day it enter into the uterine cavity. Okay, so on fifth day it will convert into the blastocyst. Okay, on sixth day the blastocyst will attach to the our endometrium. Okay, is that clear? Yes, the blastocyst it will attach to the endometrium. That is what we call as the implantation. Okay, another name of the implantation is the nidation. Okay, so remember students. Okay, nidation and implantation both are same. Okay, is that clear? The another name of the implantation is the nidation. Is that clear, Bacho? Is that clear? Yes, the question is like this: in which form the zygote enters into the uterine cavity? It enters to the uterine cavity in the form of the morula. Okay, in which form? Yes, the zygote attaches to the um, endometrium, means in which forms the zygote becomes comes to the stage of the implantation, that is the in the form of the blastocyst. Okay, is that clear? So this blastocyst further grows and it makes the fetus. Okay, is that clear, Bacho? Is that clear? Very nice of you all. Okay, so here is the next question, and I hope the answer you got for this one. Okay, so yes, the day 3, the post fertilization, the morula enters into the yes the morula becomes the stage. Okay, as I told, the after 30 hours it's blastomere, and after 30 hours it will comes to the stage of the morula. Okay, so on day 4th it will comes to the uterus. The question they have asked, yes, in which how many days after the first fertilization it will comes to the stage of the morula, means it will comes to the stage of morula on the day 3rd. Okay, is that clear, bacho? Clear? Very nice of you all. Okay, so here is the next question. Yes. Yes, read the question properly, carefully. Then we will discuss the question. Okay. Yes. What is the Piscaki sign? What is the Piscaki sign? Yes. What it stands here? Option A is telling that is the bluish coloration of the vaginal mucosa. Bacho, as I told already, the vaginal mucosa and cervical mucosa, if it is turns to a bluish discoloration. Okay. What we call this one? Yes. What we call? That's the bluish gray discoloration of the vaginal and cervical mucosa. Yes. That is the Chadwick sign. Okay. As we told, that is the Chadwick sign. Okay, so means the option A is not our answer. So then option B is the softening of the cervix. Okay, so the tip of the cervix becomes soft, means what we call this one, already discussed one, that is the Goodell's sign. What we call this one is in the Goodell's sign. Okay, so this is the Goodell's sign. Okay, clear? Yes. Then option C means this is also not our answer. Yes, asymmetrical enlargement of the uterus with, yes, very nice of you all. Okay, that is the C is the correct answer. Okay, almost all of you have given the correct answer. Yes, that is the asymmetrical enlargement of the uterus with the soft prominence of the implantation site. Okay, so what happens here? So let me make a diagram and clear you all. Yes, it is very basic. You have to understand. Yes. So students, as I told, the implantation will occur. This is our fallopian tube. This is our beautiful uterus. Okay. Yes, this is a beautiful uterus. Again, it is a cervix. So this is the vaginal cavity. So as I told, yes, this is our uterine cavity. Remember, students, one more question comes. The structure of the uterine cavity looks like reverse triangle. Okay, it is very basic question. You have to know. Okay, yes. So as I told, the implantation occurs. The ideal site of the implantation is the upper part of the uterus and posterior wall of the uterus. Okay, upper part of the uterus and posterior wall of the uterus is the ideal site of the implantation. Okay, so whether the implantation occurs in the middle or laterally. Yes, normally the implantation occurs laterally, students. So this one we call as in the, yes, eccentric site. Okay, what is the eccentric? Eccentric means, okay, that is not in the, okay, middle. So that is eccentric. The normal implantation occurs eccentric, means that is the laterally. Okay, true gestational sac implantation will be always lateral or eccentric. Means here, because of this implantation which is occurring the one side, so this side uterus becomes asymmetrically enlarged like this. Okay, so this side uterus become asymmetrically enlarged like this. Okay, so towards the site of the implantation, the uterus become enlarged. Okay, so this is what we call as in the yes Piscaki sign. Okay, so here is in option also same, asymmetrical enlargement of the uterus means yes, if the uterus is enlarging both side means that is like this. If it is enlarging means we can say this is as in the symmetrical enlargement. Only one side it is enlarging means there is the asymmetrical enlargement. Okay, is that clear? So there is the asymmetrical enlargement of the uterus with the soft prominence of the implantation side. Okay, and this is soft also towards the implantation side. So we can identify this sign, okay, with the help of the ultrasonography in the pregnancy. Okay, with the help of the USG in the pregnancy, we can see one side enlargement of the uterus, that is the normal. Okay, so that is the normal. Okay, we call this one as in the Piscaki sign. Is that clear, bacho? Clear? Very nice of you all. Okay, yes. What is the option D is telling that bleeding during the implantation? Yes, so when this blastocyst attaches to the endometrium, so at that point of the time some bleeding will be there. So okay, some bleeding will be there. So what we call this one? What is the bleeding during the implantation? Very nice of you all. That is what we call as in the Hartmann sign. Okay, what we call this one as in the Hartmann's sign. Okay, so what we call this one, that is the Hartmann sign. What is the Hartmann sign? Hartmann sign is the yes little bit of the bleeding during the implantation. We call that one as in the Hartmann sign. Okay, asymmetrical enlargement of the uterus because of the implantation. We call that one as in the Piscaki sign. Very basic question. Okay, so Piscaki sign stands here as a that is the asymmetrical enlargement. Okay, so bleeding during the implantation, we call this one as in the yes, that is the Hartmann sign. Okay, Hartmann's sign. Hope the concept is clear for this one. Okay, so fourth sign we have importantly discussed here. That is the yes. First one is the bluish coloration of the vaginal mucosa. That is the Chadwick sign. And softening of the cervix we call the Godel sign. Yes, bleeding during the implantation we call the Hartmann sign. Asymmetrical enlargement of the uterus during the implantation we call the Piscaki sign. Is that clear, bacho? Yes, do comment in the comment box. Any doubt? We can ask now. Yes, any doubt? Do comment in the comment box, bacho. Any doubts you people are having? So if the concept is clear for you all, do thumbs up in the comment box, fadafat. And who all are live for the session, so please hit the like button. Bacho, so this type of the learning we will never get on the YouTube in the free of cost. So we are struggling to get the question. We are struggling to prepare the questions. Okay, so complete night it takes for me to prepare the slides and this board contents for you all. Okay, so this much is effort is from our side, so I'm just asking for you people to just hit the like button. So do hit the like button if you like the class. Okay, so if you don't like the class, at least you put the thumbs down here. Yes, okay, very nice of you all. Okay, thank you so much. Okay, here is the next question. Yes, next question is like this: the placenta is fully formed and functioning by which week of the gestation? Okay, so the question is on the placenta. Okay, so when it will be fully formed and it become functioning. Okay, yes, the placenta is fully formed and functioning by which week of the gestation? Option A, that is the 6th week of the gestation. Option B is the 8th week of the gestation. Option C is the 12th week of the gestation, and option D is the 20th week of the gestation. Okay, when the placenta is completely formed and it becomes yes completely functioning. Okay, yes, if the question they are asking when it start to form means yes, placenta start to form on the 6th week of the gestation. Okay, so this is the when the placenta becomes start to form. Okay, and on the yes, all of you have given the correct answer. There is the 12th week is the correct answer. Okay, yes, the placenta is fully formed and becoming the functioning, so that is from the 12th week of the pregnancy. Okay, so there is the 12th week of the gestation, placenta become fully formed and it become functioning. Okay, is that clear, but is that clear? Very nice, sir. Okay, so then what about 8th week? On the 8th week, very basically we have to know. Okay, on the 8th week, yes, the fetus in the embryo of the mother, so the fetus in the uterus of the mother, which looks like a human being. Okay, which looks like human being on the 8th week. Okay, so human, okay, how you can remember? So humans are having one head, one abdomen. Okay, so like this. So this is now only it is looking like human being. Okay, so on what week of the gestation, so the embryo looks like human being means the embryo looks like human being on the yes 8th week of the gestation. Okay, on 8th week of the gestation, okay, the embryo looks like human being. Is that clear, bachcho? Yes. Okay. When the placenta fully functioning, that is on the 12th week. When the placenta start to formation, that is the 6th week. Okay, is that clear, bachcho? Yes. Yes, that is the yes. On the 6th day, implantation will start, and on the 10th day, implantation will complete, and on the 6th week, placenta will start formation, and on the 12th week, the placenta become completely functioning. Is that clear, bachcha? Yes, very nice. Okay. So here is the next question. Let's read the question carefully, completely. So then give your answer in the comment box. Okay. Yes, very good morning. So you joined very late. Yes. So class timing is daily 6:30 a.m. in the morning. Okay. So you people can join directly live session. Okay. Yes, not a problem. Just 4 to 5 questions we have discussed. Okay. Yes, very nice. So here is the question: what color coding is typically used for disposing the sharp like needles? Okay, in a healthcare settings. Okay, so in healthcare settings we are generating the sharps like needles. Okay, like blades. Okay, surgical blades. Then what we are generating the sharp. Okay, yes, some sharp stillets will be there in the our so-called IV cannula, okay, and lumbar puncture needle. So the stillet will be there. What is the stillet? Stillet means yes, in the IV cannula, many of you are yes already inserted the IV cannula to the many patients. Okay, so this is our IV cannula. Okay, I am telling what is stillet. Okay, few people don't know what is stillet. Yes, this is our beautiful IV cannula. Okay, so here is our cap. Okay, so when we will insert this IV cannula, inside this one needle will be there, and above that one there is one plastic needle will be there. So this steel needle inside the IV cannula, we call this one as in the stillet. Okay, we call this one as in the stillet. So this will be there in our lumbar puncture needle also. Yes, in the Norcet one question was there: what is the use of the stillet in the lumbar puncture needle? How many of you have marked it as correct? Yes. Yes, the use of the stillet in the lumbar puncture needle is very simple, student. Yes, in order to puncture the site easily, and in order to maintain the patency of the this particular plastic needle, okay, while inserting the needle. Okay, it is very helpful for inserting the needle. Why? Because if I am taking the plastic needle and I am like pricking, means it will won't go inside our body because the plastic is soft. So that is what inside that one we use the stillet. Okay, so for easy insertion and to maintain the patency during the insertion, so the stillet will help. Okay, so the stillet also sharp. Okay, then needles also sharp, then surgical blades also sharp, where you will discuss these all things. Yes, very nice of you all. Okay, so that is the white puncture proof bins we are using. Okay, so white puncture proof bin we are using for the discard of the our sharp materials like needles. Okay, then surgical blades and stillets, very necessarily we have to know here. Okay, so then what about needle used for the chemotherapy drug preparation? So that is also discarded in the our white puncture proof bin. So take a golden point, take a golden point here. Okay, golden point. All waste generated during the chemotherapy, means the chemotherapies are the chemical drugs where we are using to give for the treatment of the cancer. All the waste like vials, ampules, syringe, okay, and like the spreadsheet what we are using to prepare the medications. Okay, so these all things, okay, it will go into the yellow bin. Okay, and it will be separately marked as a cytotoxic drugs. Okay, yes, all the things, that is the I am telling repeatedly again. Okay, needles, except needles, okay, except sharp, everything like syringe, vials, okay, IV tubings, IV bottles, everything it will go into the yellow bin in case of the chemotherapy medication preparing. Okay, yes, very necessarily you have to know. And only sharp materials what we are using for the chemotherapy medication preparation, that will go to the white puncture proof bin. Okay, rest all waste it will go to the our yellow bin only, and that one we have to mark as a separately cytotoxic. Okay, is that clear, bacho? Very basically and importantly asked question. This type of the question will be asked in our Norcet exams. Okay, so less chance in the RB, but definitely they will ask in the Norcet exam. Okay, so here is the next question, and hope the concept is clear for the above question. And here is the next question is there in front of you all. Okay, so when does the fusion of the Decidua capsularis and Decidua paritalis typically occurs? So when it will get fused together. Yes, option A is the 4th week of the pregnancy. Option B is the 8th week of the pregnancy. Option C is the 14th week of the pregnancy. Then option D is the, yes, 20th week of the pregnancy. Many of you people didn't understand question only. So let me clear your concept related to Decidua. So then we will go for the explanation. Okay. So as I told, so we are having the, yes, three layers of the uterus. Okay. So the first layer is the endometrium. Then the second layer is the myometrium. Okay. Yes, the second layer is the myometrium. Then the third layer is the perimetrium. Okay. Yes. Similarly, we are having the layers of the heart also: endocardium, myocardium, and pericardium. Okay. Endocardium is the inner layer, myocardium is the middle layer, pericardium is the outer layer of the heart. Here, same. The endometrium is the inner layer, myometrium is the middle layer, and yes, the perimetrium is the outer layer of the our uterus. Okay. Same questions it will come. Which is the strongest and thickest layer of the heart? Means that is the myocardium, which is the strongest and thickest layer of the our uterus, means that is the myometrium. Okay, the middle layer is always strongest, thickest, and muscular and contractile. Okay, both heart and uterus. Is that clear, bacho? Clear? Okay, so the inside layer, this is what we call as the endometrium. So this endometrium only in the pregnancy. So what is endometrium in the pregnancy? We call the endometrium in the pregnancy, we call this one as in the decidua. Okay. Okay, that is the Decidua. What is Decidua? Decidua is the anything that will shed out, okay, after a certain period of the time. Okay, so like deciduate teeth we are having in the childhood. Okay, means it will shed out after a certain period of the time. Means that is what we call as the Decidua. Okay, so yes, the Decidua is the endometrium. It will shed out after the delivery. We call the pregnancy endometrium as the deciduate structure. Okay, clear? And yes, the placenta is also a deciduate organ. Okay, placenta, we are having the 3 points on the placenta. Placenta is a discoid, placenta is a deciduate, placenta is a hemochoroid. So what it means? Placenta shape is discoid in shape. Placenta is shed out after delivery. We call this as a deciduate, and placenta is a hemochoroid. Why we call hemochoroid? Means it will be in the direct contact with the maternal blood. So placenta is called hemochoroid, placenta is discoid, placenta is deciduate. These 3 points, golden points on the placenta. Okay, that is very basic. And here also the endometrium of the pregnancy, we call this one as the decidua. What is decidua? Decidua is the endometrium of the pregnancy. Okay, so this decidua, when we study this decidua, okay, so the parts of the decidua. So what they have asked in the question, yes, the when does the fusion of the decidua capsularis and Decidua paritalis typically occurs. Okay, so that one you have to know basically what is Decidua capsularis and what is Decidua paritalis. Okay, so as I told, here this is the endometrium and this is our blastocyst. Okay, so blastocyst, yes, so just below the blastocyst, yes, it will attach to the endometrium, and endometrium of the Decidua, okay, that is below the, okay, Decidua or the endometrium, that is just below the our blastocyst. We call this one as in the, yes, Decidua basalis. Okay, we call this one as the Decidua basalis. Okay, so the endometrium layer which comes from above, okay, from above of the our blastocyst, okay, which is looking like cap layers. Okay, so it is above the blastocyst, means it is cap will be there in our above the head, no? So like that. Okay, this is we call it in the Decidua capsularis. Okay, so then rest all endometrium except the site of implantation. So this is what we call as in the Decidua paritalis. Okay, this is what we call as the Decidua paritalis. They are asking the question. Okay, so which one is like this, when does the Decidua paritalis and our Decidua capsularis fuses together? They are asking the question. This is the Decidua paritalis. This Decidua paritalis also we call as in the Decidua vera. Okay, and this Decidua capsularis. So when these both fuses together, students, when the blastocyst grows. Okay, so when the blastocyst become big on the 14th week of the gestation. Okay, on the 14th week of the gestation, yes, on the 14th week of the gestation, this Decidua capsularis and Decidua basalis fuses together at that point of the time, and uterus also become thick, full. Okay, so see, look at this one. Where is the Decidua capsularis? Yes. Okay, let me take this one. Okay, yes. this is our Decidua capsularis. Okay, and here is our Decidua paritalis. Okay, so if this Decidua capsularis, this fuses with this Decidua capsularis means, sorry, this Decidua capsularis fuses with this Decidua paritalis means, at that point of the time this blastocyst become big. Okay, like this means it will fill the complete uterus. The again one more question comes, when does, yes, the uterus of the pregnancy become full? Okay, uterus of the pregnancy become full. So on the same again answer, that is the 15th week the uterus of the pregnant become full, and on the 14th week Decidua capsularis and Decidua vera fuses together. Okay, this is the basic answer we have to give. Okay, where is the option here? Yes, the option here, option C, that is the on the 14th week of the pregnancy, yes, Decidua paritalis and Decidua capsularis which fuses together. Okay, on the Decidua you have solved the many questions here, knowingly unknowingly, students here. So what all are the questions we have solved here on the Decidua? Yes, the Decidua which is below the blastocyst, what we call that one is the Decidua basalis. Okay, the Decidua above the blastocyst, we call that was in the Decidua capsularis, and the Decidua except entire site of the, okay, except the site of the implantation, that is what we call as in the Decidua paritalis. Okay, yes, below the blastocyst basalis, above the blastocyst capsularis. Okay, so Decidua except the site of implantation means the whole Decidua, that is what we call as the Decidua paritalis or the Decidua vera. So these are the three types of the our Decidua. Okay, very importantly how to know and keep in your mind and give the best shot in the exam, that will get your rank, students. Okay, so here is the next question. Yes, option is there very simply, and the question is also very simple, already we have discussed here. Okay, this one, so which of the following is the not a type of the Decidua? Okay, so not a type of the Decidua, yes, that is the Decidua basalis is a type of the Decidua, Decidua capsularis is a type of the Decidua, Decidua paritalis, that is also a type of the Decidua, but Decidua spongiosum, this is the layer of the Decidua, students. In a question they have asked the type of the Decidua. Okay, so basalis, capsularis, paritalis, these are three are types of the Decidua, and Decidua spongiosum is the layer of the Decidua. Okay, so as I told previously, okay, this Decidua, okay, this Decidua is also having the three layers. Okay, so this Decidua is also having the three layers. Let me clear you all. Okay, so yes, so as I told, consider this one as the innermost layer, that is the endometrium. So this endometrium in the pregnancy we call the Decidua. So this is having the three layers. Okay, so the first layer is the, that is the Decidua compactum. Okay, so then second layer, let me change the pen color here. Yes, this is the second layer is the Decidua spongiosum, then the third layer is the Decidua basalis. So these are the three layers. Okay, first layer is the, yes, first layer is the our compactum, second layer is the spongiosum, and third layer is the Decidua basalis. I will clear 10 questions from this particular structure. Okay, you have to focus. Okay, many less teachers on the YouTube, they will teach you, okay, in depth regarding this one, but the questions will strike in the exams. Okay, do concentrate perfectly. You will get confused between the types of the Decidua and layers of the Decidua. I am separately teaching you people. Okay, already I have explained what are the three types of the Decidua. Now I am explaining layers of the Decidua. Okay, what I am explaining now, that is the layers of the Decidua. Okay, there are three layers, that is the Decidua compactum, spongiosum, and basalis. Okay, so the question will come, what is the innermost layer of the Decidua? That is the innermost layer of the Decidua is the compactum. What is the middle layer of the Decidua? That is the spongiosum. What is the outer layer of the Decidua? That is the Decidua basalis. Okay, so where the implantation occurs actually, which Decidua? Yes, to the Decidua compactum, the implantation occurs in the Decidua compactum. Okay, so where the placenta attaches, actually the placenta attaches to the Decidua spongiosum. Okay, so the placenta attaches to the Decidua spongiosum. Okay, so which one, which makes the, yes, fetal side, sorry, maternal side of the placenta, which layer which makes the maternal side of the placenta? Maternal side of the placenta is made by the Decidua basalis. Okay, so which layer which makes the fetal side of the placenta? Fetal side. Okay, this is the placenta. Okay, so this is the maternal side of the placenta, and so this one is the fetal side of the placenta. Okay, from here the umbilical cord will originate. Okay, the maternal side of the placenta will be made up of by the Decidua basalis, or we can say, yes, the basalic plate. Okay, so same, this is the basalic plate, we can say. or Decidua. This is the yes which makes the maternal side of the placenta, and yes, this one chorionic frondosome. This chorionic frondosome, this layer, which is we call this one as in the chorionic frondosome, which makes the fetal side of the placenta. Okay, question is clear. Fetal side of the placenta is made up of chorionic frondosome. Maternal side of the placenta is made up of the yes, that is the Decidua basalis. Inner layer of the Decidua is the Decidua basalis. Okay, so from here the maternal side of the placenta forms from the Decidua basalis. Okay, where the placenta attaches to the Decidua spongiosum. Okay, where the implantation occurs to the Decidua compactum. Very basically, we have to know the 4 to 5 or 6 questions we have discussed on this structure. Okay, that is very in depth and it will comes in our exams. Okay, so yes, is that clear, students? Yes. See here they have asked for the type of the Decidua. Okay, type of the Decidua we have discussed. Okay, this is the endometrium. So this is the site of the implantation. Okay, so below the site of the implantation, this Decidua we call Decidua basalis. Okay, so above the blastocyst, we call that one as the Decidua capsularis, and rest all the Decidua. Okay, so we call this one as the Decidua paritalis or the Decidua vera. Okay, so paritalis, capsularis, basilic are the three types of the Decidua, and yes, Decidua spongiosum is the layer of the Decidua. So the answer for this question is the option C, option D. That is the Decidua. Yes, spongiosum is the not a type of the Decidua; it is the layer of the Decidua. Okay, this is the layer of the Decidua. Hope the concept is clear. Okay, we have to focus on the question. They have asked a layer or they have asked a type. Okay, so that is very basically you have to understand on this one. Okay, so here is the next question, bacho. Yes, read the question properly, carefully, then try to give your answer. Okay, so what is the Y site in IV tubings is used for? Yes, it is very basic question. It is a very practical question. Okay, you people can get your answer. Okay, practical question. Okay, very basically and very practical question. It will comes in your upcoming exams. Okay, yes, can anyone able to answer for this one? Can anyone able to answer for this one in the comment box? Vacho fadafat, do comment. Yes, what is the Y site in IV tubings? So first of all you have to know what is the IV tubings. Okay, what is the IV cannula, what is the IV bottle. Okay, as all of you know that we are using the IV fluid bottles, that is the this is what we call as the IV bottle. Okay, so this may be a yes normal saline, a Ringar lactate, dextrose normal saline, DNS. This is what we call IV fluid bottle. Okay, so the tube we are using. Okay, yes, this is what we call as in the IV tubings. Okay, don't confuse. This is what we call as the IV tubings. Okay, so from here we have the cannula. Okay, so that is what we call as the IV cannula. Okay, to here we will connect this one. Okay, so this is the IV cannula, this is IV tubings, and this is IV fluid bottle. Okay, so the stand we will keep here, that is the IV stand. Okay, this is the actually practically happens here. Okay, so in this IV tubings we are having the structures in between like this. Okay, like this. Okay, so which it makes a Y structure here. Okay, this one. Okay, it is making like a Y connector. Okay, so for what purpose we are using this Y connector? Can anyone notice this Y connector in your IV tubings? In most of the government settings it will not comes, but in the private and in the according to the like very good guidelines, so the IV tubings with Y set also we can use very necessarily. Okay, yes, very nice of you all. What is the use of this one? Y set means it is helpful for the administration of the additional medications. Okay, so if you want to administer any additional medications, you can open the cap from here and you can directly connect your another tubing, so it will go simultaneously with another medications. Okay, so if you want to administer additional medications without disconnecting the tube, so you can use the Y connector. Okay, so that is the use of the Y connector, that is the administration of the additional medications. Is that clear, bacho? Clear? Very nice. Okay, so here is the yes, very basic question and important question for you all. Okay, which cell is produces the HCG? Which cell is responsible for the production of the human chorionic gonadotropin? Yes, what is the full form of the HCG? That is human chorionic gonadotropin. Okay, this is the full form of the HCG. Okay, so there are another one more hormone, that is the human chorionic somatotropin. Human chorionic somatotropin is the another name of the human placental lactogen. That is the different hormone. Okay, so yes, so this is the different hormone. This is the human chorionic gonadotropin HCG. It's produced by the yes, very nice of you all. That is the Again, option C as the correct answer. That is the syncytioblast is the correct answer. From the HCG is produced from the syncytioblast, and this syncytioblast very importantly produces the yes HCG and our HC. Yes, that is the human chorionic gonadotropin, human chorionic somatotropin. Okay, this both. This also called as human placental lactogen. Okay, HCS is also called as human placental lactogen. These both hormones will be produced by the syncytioblast only. So because of that, the syncytioblast is also called as in the yes hormonal factory of the placenta. Okay, this is also called as hormonal factory of the placenta. Okay, very basically we have to know that is what is also called as the hormonal factory of the placenta. That is the syncytioblast is also called as the hormonal factory of the placenta. Okay, it produces the HCG and it produces the HCS and HPL. Okay, which hormone is responsible for the morning sickness? Yes, which hormone is responsible for the morning sickness? What is morning sickness? Morning sickness is the yes nausea, vomiting, where the pregnant woman gets in the first trimester usually. So that is in the pregnancy we call the morning sickness. Nausea, vomiting in the pregnancy we call as the morning sickness. So which hormone which is very much necessarily responsible for the morning sickness? Yes, that is the HCG. Okay, so HCG is the yes hormone which is very much necessarily for the morning sickness. Okay, in one condition we will study in the disease condition, that is the yes hydrity from mole. Okay, or we can say the molar pregnancy. In that one, the excessive proliferation of this syncytioblast will be there. Okay, so this syncytioblast excessively proliferates means the excessive syncytioblast will process. The excessive syncytioblast means the excessive HCG will be there. The excessive HCG means yes, the excessive HCG means excessive vomiting will be there in the pregnancy. So the excessive vomiting which leads to the hyperemesis gravidarum. Okay, what is the excessive vomiting in the pregnancy we call the nausea, vomiting in the pregnancy we call the morning sickness. But the excessive vomiting in the pregnancy, okay, with evidence of the fluid and electrolyte imbalance, we call that one as in the hyperemesis gravidarum. Okay, the word itself telling that that is the it is the excessive vomiting in the pregnancy. Hyper means yes excessive. Emesis means vomiting. Okay, gravidarum means the pregnancy. Okay, so the hyper means excessive, emesis means vomiting, gravidarum means pregnancy. Hyperemesis gravidarum will see in the case of the our molar pregnancy or the hydatiform mole disorder or in the choriocarcinoma, where the excessive proliferation of the syncytioblast will be there. Okay, so then again where we will get the excessive HCG? Okay, in the Down syndrome. Okay, only one trisomy where we will get the increased HCG, that is the Down syndrome. But in the trisomy 18, trisomy 13, the HCG level will be low. Okay, in the abortion also HCG level will be low, and in the ectopic pregnancy also HCG level will be low. Okay, so yes, in what all are the condition, the low level of the HCG will get. Yes, the low level of the HCG will get in the yes condition of the yes, you can make the pneumonia of the okay, that is the eta. Okay, so that is the yes, in the ectopic pregnancy HCG will be low. Okay, and in trisomy 18 and 13, trisomy 18 is our Edward syndrome, 13 is our Patau syndrome. Okay, so remember in the trisomy 21, that is our Down syndrome. In the Down syndrome, the increased HCG will be there. Okay, in the trisomy 18 and 13, Edward syndrome and Patau syndrome, the HCG amount will be getting low. Okay, in case of the abortion. Okay, what is abortion? What is the definition of the abortion? Abortion is the yes termination of the pregnancy before the period of the viability spontaneously. That is called as the abortion. If we are making means, that is what we call as the medical termination of the pregnancy. Okay, the healthcare provider assisting yes to take out the product of conception before the period of the viability means we call that one the medical termination of the pregnancy. If it is occurring spontaneously, so that is what we call as the abortion. Okay, yes, is that clear, bacho? Clear. Okay, so these are the three conditions where our human chorionic gonadotropin will get decreases. Okay, yes, and what are the conditions where the HCG will increases? Yes, you can remember the condition where the HCG will increases. Okay, HCG will increases in our yes, already I have told the case of the hyperemesis gravidarum, that is in the molar pregnancy. Molar pregnancy is a just a second, please. Yes, that is the molar pregnancy. Yes, So molar pregnancy is also we can say that is the hydatiform mole. Okay, in the choriocarcinoma, molar pregnancy, hydatiform mole, choriocarcinoma. Okay, there is increased HCG will be there. So because of increased HCG, there is increased vomiting will be there in the pregnancy. So increased vomiting in the pregnancy, we call this one as in the hyperemesis gravidarum. Okay, is that clear? Clear. Okay, then in the RH negative mother, also, yes, increased HCG will be there. Okay, then where we will get the increased HCG? Yes, in the twins pregnancy, increased HCG will be there. Very nice. Then where we will get? Yes, these are the basic thing we have to identify. Okay, but in all these condition, vomiting will be excess, and there is highest chance of the yes hyperemesis gravidarum is there in all these condition. You have to remember and correlate in the question and give answer. I am clearing your concept here. Okay, बच्चों ठीक है? Yes. ಓಕೆನಾ ಎಲ್ರಿಗೂ ಓಕೆನಾ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಆಗ್ತಿದೆಯಾ ಎಲ್ರಿಗೂ ವೆರಿ ನೈಸ್ ದಟ್ ಈಸ್ ವಾಟ್ ಮೈ ಮೋಟಿವ್ ಇಸ್ ಓಕೆ yes my intention is the concept should be clear for you all okay that is the very much helpful to solve the question in the exams the questions will be coming in your in front of you all by changing the body of the question so if the concept is clear you people can understand the question and answer the question that is very much easier okay yes okay na artha aita very nice of you all okay yes here's the next question but the answer for this question is clear we have discussed the yes the nearly 15 question on the HCG okay that may comes in front of you all okay with different style okay so here's the next question yes Bajo, clear yes which of the following is not a function of the placenta okay so this is the 5-star question for you all okay this is the 5-star question for you all which of the following is not a function of the placenta so option A is that produces the hormone yes is this produces the hormone yes so it produces the hormone so what all are the hormone it produces the basically two types of the hormone that is yes one is the steroid hormone one is the proteinase hormone okay steroid hormone in the steroid hormone two hormones it will come that is the estrogen and progesterone okay in the proteinase hormone we will have four hormones okay what all are the four hormones it will comes in the proteinase hormone that is first one is the HCG okay then again human placental lactogen then again pregnancy associated plasma protein A that is the papa okay then again relaxin okay so these are the hormone which produces by the placenta clear bachcho clear so yes the steroid hormone and proteinase hormone will be there okay in the steroid hormone estrogen progesterone will come and yes the in protein hormone human chorionic gonadotropin human placental lactogen then papa that is the pregnancy associated plasma protein A then relaxin okay so these are the different type of the hormone which is produced by the placenta so placenta will perform the endocrine function clear bachcho and what are the what style of the questions may ask in the exams okay they can ask the exams like which one of the following is a steroid hormone produced by the placenta and they will give the options from the yes steroid hormone progesterone they will give and rest all three options they will give in the from the protein hormones so if people will get confused all these four hormones will be get produced by the placenta but they have mentioned in the question like the steroid hormone okay so the steroid hormones means we can just give the answer there that is the progesterone or the estrogen okay so all remaining three options will be the proteinase hormone okay is that clear bachcho very nice of you okay so then yes it filters the harmful substances of course it filters the harmful substances okay so yes so it makes the placental barrier with the four layers okay so placental barrier will be made by the four layers so that will be filters the harmful substances okay only it will allow the uh, substances which is less than the 500 dalton size okay if the substance which is less than 500 dalton size that will crosses the placenta okay if the substance which is more than 500 dalton size it will not crosses the placenta okay so it filters the many of the harmful substances that is also protective function of the what we call our placenta is there that is also correct answer it synthesizes the red blood cell no students as of you are given which is not a function of the placenta okay not a function of the placenta that is a synthesis of the red blood cell will be there from the our yes in the intrauterine lab where from the erythropoiesis occurs okay in the intrauterine lab the erythropoiesis is occurs from the yolk sac okay yes the function of the production of the yes the red blood cell or we can say the erythropoiesis in the intrauterine life that is the primarily by the yolk sac okay from the yolk sac after the first trimester it will go to the liver okay from the liver it will go to the our yes, the red bone marrow. It will go to the red bone marrow. Okay. So yes, is that clear, bacho? This is the how sequence of the erythropoiesis will change in the intrauterine lab. Okay. So in the first trimester, it is by the yolk sac. Okay. So, but the placenta is not responsible for the production of the red blood cell or the erythropoiesis. Okay. Rest all it can exchange the gases also. Okay. Yes, it is very basically the placenta is as also having the respiratory function where yes the deoxygenated blood which is bring from the our umbilical artery it will takes and oxygenated blood it will brings from the maternal artery. Okay, and it will give through the placenta to the our umbilical vein. Okay, this is having the gas exchange function also means the respiratory function also or umbilical so our placenta will do here. Okay, but the synthesis of the red blood cell is not a function of the placenta. Okay, so let me revise the function of the placenta quickly. Okay, the definitely one questions they can ask in your exam. Okay, yes, as I told, placenta can do the endocrine function. But you clear the placenta can do the endocrine function. How? As I told, yes, the placenta is having the two types of the hormone. That is the proteinase hormone and steroid hormone. In the proteinase hormone, again we are having the four type of the hormone. That is the yes, HCG, HPL, pregnancy associated plasma protein A, then our relaxin. Okay, in the steroid hormone we are having the two hormones. That is the estrogen and progesterone. Is that basic questions? Yes, very basic questions. Then yes, it is having also excretory functions, students. Excretory functions means the metabolic waste which is bring from the fetus, it will be excreted in the maternal circulation with the help of the placenta. Means the placenta is also having the excretory function. Excretory function. Okay. Yes. Okay. Then it is also having the respiratory function. How? How it is having the respiratory function? Student, as I told, it gives the oxygenated blood and it will take the carbon dioxide from the fetal circulation and it will give the oxygen to the fetal circulation. So means the gas exchange will be there. Okay, this is considered fetal circulation. This one is the maternal circulation. The carbon dioxide moves from the fetal to maternal circulation and oxygen moves from the our maternal to fetal circulation. Means the placenta is having also having the respiratory function. Okay, so then what is the placenta is having? Placenta is having the Hofbauer cells. Means the placenta is also having the immune and protection function. As I told the in the first question itself, the placenta is having the phagocyte called as the Hofbauer cells. Okay, it can also produce the immunity. So the immune function and protective function also the placenta is having. Okay, yes, the placenta is having also having the nutritive function, students. So this is the placenta means yes the necessary glucose, okay, protein, lipid, it will crosses the placenta and it will comes from the maternal blood to the fetal blood. Okay, so the placenta is also having the nutritive function. Okay, so these are the basic function of the placenta we have discussed. Okay, we will discuss again in the next session in detail. So how glucose passes the placenta, how protein crosses the placenta, how lipid crosses the placenta, how water soluble vitamins, how protein soluble vitamins crosses the placenta. These are the also questions which will comes in your exams. We will discuss in the next session. Okay, so if the content is very much helpful for you all, okay, so if you found any strong, okay, if you found any like your preparation is feeling of the strongness will be coming in your preparation means, okay, so that is the quality of the master nursing classes, that is the quality of the content what we are bringing in front of you all. Okay, in order to clear your concept rather than the questions. Okay, if your concept become clear, the questions becomes clear. Okay, so they can ask the any kind of the questions from these components. Okay, so what I have discussed here in detail. Okay, so is that clear, bacho? Yes, we will meet in the next session again. So don't forget the time, that is the morning 6:30 am. Yes, the master will be waiting for you all and the entire team of the master nursing classes will be waiting for you all. Okay, yes, if you found any doubt in between the session, you can comment in the comment box. I will try to solve your question in the next session. Okay, yes, and don't forget to write the review in the comment box after finishing the class. So that will help me to yes to bring more helpful content in front of you all. Okay, so we'll meet in the next question. Tab tak ke liye Jai Hind, Jai Bharat. Okay, if you are not a part of my Telegram group, do join the Telegram group. I have given the description link in the comment box. Okay, so yes, we'll meet in the next question. Yes, that link is there in the description box and in the comment box, both students, for my Telegram group. Yes, do join the Telegram group. Okay, so we'll meet again in the next question. Thank you so much. Jai Hind, Jai Bharat.